Today I'm going to talk a little bit about options in body contouring. A lot of times patients come to me and they complain about how their abdomen looks, but they don't really know exactly what they need. They might want liposuction, or they might need a tummy tuck, or they might even need a circumferential body lift. And basically, what I'm going to offer them is tailoring to their body to what's going to give them what I think is going to be the nicest result. Obviously, there's different amounts of recovery for each and different levels of scarring, and these are things that we talk about in the consultation. But really, to give the patient the nicest result, we sometimes need to excise skin. But I'm going to first talk about liposuction. And liposuction is when patients tend to have a little bit too much fat, but their skin quality is okay. And so we can try and remove the fat with small incisions using a liposuction cannula through very small holes. We tried to hide those scars in the lower abdomen, just about right about here. That didn't work. About there, and there is typically in the lower panty line area, and then usually around the belly button. And then we'll try and remove fat from the areas where there's excess, which could be anywhere in the entire abdomen, but often we try to accentuate some of the features of the abdomen, give it a little bit more of an athletic appearance. And so we definitely want to focus on taking areas on the hips when patients have too much. Also, we'll take it on the lateral sides of the rectus muscles so that the rest of the muscles can look defined. And women want to make them too muscular appearing, so we're not too aggressive with this. And obviously, we want to avoid creating any contour deformities. And so, I'm pretty conservative in removing fat in those areas. And then, but when patients have too much skin and excess skin, which is very common after having children, sometimes doing liposuction on its own is not enough. A very common procedure we offer is a standard abdominoplasty. And a standard abdominoplasty is when we're removing most, if not all, of the skin below the belly button. So we tend to remove the skin from about the level of the belly button, and then again down to the pubis area. And so we remove, skin right here. And then we undermine all the way up to here and re-drape that skin so we can have the scar hide down here. All right? And then we have to make a new hole for the belly button that's been still attached to the abdominal wall. At the same time, we also usually will tighten up that muscle that might have split. So you have two muscles here called the rectus muscle that often spread apart after you have a baby, and they don't always come together. And we can tighten it up. It helps improve the contour of the abdominal wall, bringing the abdominal wall in, and also will help pull in the hips. And so we will tighten up the areas between those two muscles right there. And so that's a high satisfaction procedure where patients get entire improvement of their abdominal wall. Now, a lot of times patients really don't need that much skin excision. Sometimes they might have a little bit of excess skin just below their belly button. They might not have the abdominal wall problems, and those might be good cases for a mini tummy tuck. And in a mini tummy tuck, we're not removing all the skin below the belly button. Typically, we leave the belly button in place, but we still have this scar. It may not be quite as far, but we just remove the skin, about half the skin below the belly button. And then we undermine all the way up. Usually the undermining area is from about here to here. And then we pull that down so we can have the skin all laid down here in the low pubic area as well. We're not usually tightening the abdominal musculature in this surgery, but sometimes it's all customized. It depends what the patient needs. But this tends to have a quicker recovery, and you don't have a scar around the belly button. And then sometimes patients need a lot of skin removed. They might need to have skin removed all the way to their mid-side of their back, which is called an extended abdominoplasty, or they might need it all the way around their body, which is called either a circumferential abdominoplasty or a body lift. And part of the reason they call it a body lift is because then it can also pull up the thighs and the buttocks, which often become deflated and fall after massive weight loss, such as people who have had weight loss surgeries called bariatric surgeries. And so these are much larger surgeries that take a little bit longer. Sometimes we have to do them in the hospital because they require a stay overnight because they're a little bit longer surgeries and there's a little more fluid loss. And then there's another option. Sometimes patients have a lot of excess loose skin in their midline of their abdomen, and so sometimes they would rather have that skin removed and have a midline scar. And this is what's called a Fleur-De-Lis Abdominoplasty, and this is kind of like the standard abdominoplasty, but a little bit more. So in a Fleur-De-Lis Abdominoplasty, we'll go just like this, but then we might go all the way up like that and excise some of the central excess skin, and then we bring it together so it ends up being just a midline scar where we have the belly button around there. But the benefits of that is you pull in the skin all the way around the body like a corset, and so it really tightens up the sides and flanks. And so this, while a lot of patients, obviously we don't want to have a midline scar if we can avoid it. Some patients, they have a lot of loose skin or stretch marks. They'd prefer to have that midline scar than maintaining all the stretch marks, because we can often cut out a lot of those stretch marks using that midline procedure. So like I said, this is all where each patient comes in and they say, you know what, this is what I don't like about my belly. And I say, well, in my opinion, this option is going to give you the nice result, and we might do a little modifications on reaching whatever the patient's goal is. And so if you have any interest for it, come on in and see us.